What herbs would Dr. Morse recommend using in steam inhalation treatment to counter asthmatic attacks as an alternative to pharmacological rescue inhaler, bronchial dilators, aerobid, and all of that? The problem, of course, a lot of them have steroids in them, so there you goes your adrenal glands. They also are inhibitors and suppressors. Look at the difference between how herbs work than, let's say, aerobid. One suppresses, it's a bronchial dilator, but in doing that, it's a suppressor. So you have a kickback on that. Remember the teeter-totter? You can actually get worse out of that. You feel it, and you need it, and after a while, you find yourself going to that inhaler more often and more often, especially with the use of steroids. Anti-inflammatories. Well, in chemistry, guys, what are we talking about? Anti-acids. So the 4-lung formula, or the 3-lung formula, excuse me, is the best one, and the lung formula itself are the best one to help with that. To break up and to loosen up mucus. Here's the problem. Asthma isn't just sputum problems, isn't just mucus problems. There's a much deeper problem to asthma than congestion. You would be simple pneumonia with that, or bronchitis. No, asthma is one of the first steps of COPD, chronic obstructive pulmonary disease. And so, what else is wrong? What's the big problem with an asthmatic emphysema, full-fledged COPD? Where's the big problem at? The adrenal glands and kidneys. But the adrenal glands, why? What does the adrenal glands produce in the medulla oblongata? What does the adrenal glands produce in the medulla that is essential to breathing? Neurotransmitters. You got to have neurotransmitters or your heart can't pump and your lungs can't breathe. Remember, you have duality in essential pumping, breathing, all these things, a movement, right? Push-pull, sympathetic, parasympathetic. So that's dualistic movements to get things moving. Movement creates action, right? And then action is energetic and chemical. Then you have polarization and magnetics, and all this sort of thing going on. Cool stuff. But remember, this is just the processes of life. It isn't you. It's the illusion, and the illusion is so good that you can study the processes and get lost. You can get lost in worlds far, 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 far away, both in big and both in small. There's no saying. You can take the head of this pen here, cut it in half, cut that half in half, cut that half in half, and keep cutting all those halves in halves, and you'll still never find the smallest part of God. Whew. Crazy. So, you have to work on your adrenal glands, honey. You have to work on, this is Corey. You've got to work on your adrenal glands, bro. Well, it could be female. Yep. Adrenal glands. Neurological. Bring up those myelin sheaths. Bring up that electricity because you're going to find low blood pressures. If they're high, remember, that's your kidneys bumping up the adrenals. Get that cleaned out. You're going to run low neurotransmitters. You feel tired. Energy. We're looking for ATP. We're looking for energy. Well, wait a minute. We have other forms of energy in the body, right? Right. And some of them in the forms of neurotransmitters. And that's exactly where we're going here. And how would he recommend doing this? Please notify me by email as regards his answer and whether he does a YouTube video on this topic. Thanks and blessings, Corey. Okay, here it is, down here. So she can show you that. Well, first of all, I'm going after my lymphatic system, number one. But and the reason I don't get too much thinking about the lungs other than using the 3-lung tea or the lung formula is you're going to go through it. I don't care if you've got congestion in those bronchi or in those lungs. At some time or another, you're going to start coughing this up. The beauty of hydration, and you're 90 years old. Oh, I just cracked my sternum. Oh, I just cracked my ribs coughing too much. There was a code blue on one of the floors, the hospital I was working at the time. And I run up there because I'm in cardiopulmonary. That's our job, is to run codes, right? But the main MD that runs codes is generally the emergency room doctor, right? So there was a doctor, this cardiologist, he was awful handsome. He was a good-looking man. He was from Spain or somewhere, and this guy was, man, all the ladies went to him. He was a good-looking cardiologist. So this old lady had coded, right, and he was on her and giving her chest compressions. Well, I come running in, he goes, here, take over for me, and he says, looked at me, and he said, don't crack her sternum. And so I looked at him, and I got on her, and I went like this, and he'd already cracked all her ribs. Oh, you got to be careful with an MD. I just have to tell you. And you want an IV started by an MD? Good luck. Let me tell you. Whew. God, I got stories out the butt. But yeah, you want to get on that. And I would take the antispasmodic on a regular basis, like a half a dropper full or dropper full 3-4 times a day, along with 3-lung, the lung formula. Now remember, when you start hydrating, and go on your fruit diets, because remember, when you start hydrating, a couple things are going to happen. You're neurologically going to pick up, for sure. No question about it. Now, your adrenal glands, you might feel really good for a week or two, and then you might kick into some healing crisis, so don't freak out with that. But just that's why it gives you a couple of weeks to feel good, so that you know that this is how you're going to feel, but now we're going to kick in and get stuff cleaned out. So just remember, sometimes you feel really good for the first week or two, and then others go right into it. Some people are just like ticking time bombs, and as soon as you start any type of electrical hydration, boom, boom, cold and flu-like symptoms, sinuses dumping, fevers to get the skin to dilate, and body starts kicking out all this. How does that happen in chemistry? Explain it to me, guys. So, you think there's a conscious being running everything? But a conscious being would mean that there's only, well, that would have to be an isolate, right? But that's how I would go. Clean, but strengthen those adrenals, get neurotransmitters up. If you're running low blood pressure, take licorice root, but get the adrenal formula. You might even bump with a 400 milligram adrenal cytotrophin or glandular just to, hello? Yeah, I'm an adrenal cell. Oh yeah, I remember now. Well, I mean, our genetics are losing our consciousness of the cells. Oh, I don't know what I'm here for. Matter of fact, the male-female aspects, even that.